with our guest, and I've learned so much, and she has so much to offer here that I mean, it's absolutely amazing. She's an oncology nurse, she's a cancer podcaster, she's an author, and the list goes on and on. But I'll let her do herself justice. She is an awesome, awesome person, and I just really, really enjoy spending time with her and listening to her and learning from her. And so I hope all of you will be too, which I know you will. And so at this time, I'd like to invite our guest, oncology nurse and podcaster and renowned author, Jill Squire. Please introduce yourself and let's get into this.
Hi, everybody. I'm thrilled to be here. I always feel like Mark is talking about someone else when he introduces me. Thank you for the very warm welcome, everyone. I'm a very long time oncology nurse. I've had my OCN since 2014 and was in oncology prior to that and in nursing well prior to that. Um, and I span hematology and solid tumor oncology, medical oncology as well, and radiation oncology in my experience. Um, Navigation, bedside, chairside management, and so on. And also I do support group facilitation. And through all of that, what has become really apparent to me is that people struggle advocating for themselves. And that has become a passion of mine, is people becoming more comfortable and confident in advocating for themselves to avoid gaps in care and to understand what's happening and to be able to ask questions and to ensure that they are getting good information. And there are so many steps involved. There's so many moving pieces involved. And to understand all of that is really imperative. And it's not just with diagnosis and not just with treatment, but on the entire journey. And that's become my mission, is to help people to be able to do that, and to be able to do that effectively and walk on this journey with comfort and confidence, and to be comfortable asking questions and getting answers and finding information. Um, I've put together a guide for that, but we won't go into that right now. What Mark and I have talked about, and Mark has become an incredible resource to me as well. And the support group I facilitate, I will receive so much more from them, and I have in the years I've been facilitating, than I will ever give. It is such a joy to work with them. And so many of the people that I work with in that group have become dear friends. But they're so close to me in my heart in so many ways. And I hear things through them that I would never hear in a clinic environment or a navigation environment. And that has opened my eyes even further um, to the challenges that people meet. And one of the things that Mark and I talked about that we thought would be a good topic for tonight is being in the right mindset to be on the cancer journey at any point, whether it's diagnosis, whether it's being in active treatment, maintenance treatment, survivorship, and dealing with all the challenges of survivorship, um, and how to keep moving forward and how to be engaged in life at any point through that. And Mark and I actually just had a conversation about that. But one of the ways is to be mindful of what's happening around you. Definitely keep a journal. Absolutely keep a journal. That is imperative above all things. Write down your questions when you think of them. Write down your next steps so you don't lose track, because there are so many moving pieces at any given point. Keep a calendar so that you know where you need to be when you need to be. And say you're in the survivorship area of things, so that you know when your next surveillance visits are or your wellness visits are for the people that you're interacting with for wellness, whether it's a nutritionist that you're seeing or your PCP, or an integrative oncologist or someone along those lines. But keep on top of those. Um, Also, keep track of how you're feeling, because changes in how you're feeling are really important to be aware of. And if you write them down, it's a lot easier to talk with your provider about them. And it's real data. It is absolutely real data. And again, that is when you are in active treatment, maintenance, or on the survivorship. And I consider survivorship from day of diagnosis on, but on the journey, at any point of the journey. When you notice a difference in how you feel, write it down and then keep track of it, because that is so important to talk about. And it's really important to bring up, especially now that we're in the days of immunotherapy, because a lot of those symptoms can occur months and years after radiation therapy. A lot of those symptoms can occur months and years after. We're seeing that now, that things can occur months and years after treatment. And so, this is a double-edged sword. We're in an age where treatment is getting us to a point where we're in survivorship, but now we're dealing with survivorship. Um, there is an active movement for um, expert survivorship care, and I am so thankful for that. And that is something I'm becoming very passionate about and involved in, and I'm very grateful for that. And so be aware that that is happening. But write your symptoms down and report them, because it's much easier if you have them written down and you're able to look at them. Another part of being in the right mindset is having someone with you during your visits, because that is a second set of ears to listen and to take notes and to understand the conversation. If a complex topic is being explained to you, repeat it back. Take very good care, and your doctor will correct you if, when you're repeating it back, if you've repeated back something incorrectly or not quite understanding it. Use credible sources for information, such as the American Cancer Society, NCCN patient guidelines, which is National Cancer. I'm sorry, I'm drawing a mind blank now right now for NCCN, and I'll get right back to it. But it's NCCN. N is in cat, Nancy. C is in cat. C is in cat. N is in Nancy. Patient guidelines. They are phenomenal in terms of information, and those are two excellent credible resources for information. And there's many, many more out there. But those are two excellent go-tos. The other piece of this is to ensure that you're taking very good care of yourself at any point. And that means good sleep, eating well, getting exercise, which will also help you to fight fatigue at any point on all of this. Thank you. National Comprehensive Cancer, right. Um, National Comprehensive Cancer, and the N is at the end is network. So yes, National NCCN is National Comprehensive Cancer Network. And it's the patient guidelines piece of that. So there's excellent information in that. Thank you, Rochelle. I appreciate that. Sometimes I draw a mind blank with NCCN with all the acronyms there. But in any case, the other piece of being in the right mindset is to also have the shared experience. That is imperative. And you're here having the shared experience, so I congratulate you. But if you know of anybody else that is going through this, please encourage them to reach out to their local cancer support organization, and or be here where they are in something like this that is beyond local support, and and share be with other people that have the shared experience, because you find out tips and tricks that you wouldn't find out otherwise. And you don't need to explain anything. You can just start talking and other people understand it, and you can lean into them and lean on them in ways that you can't in other circles and with your family. These people get it. And I have seen amazing things happen in the support group setting. And so many people say, I wish we had started this earlier. I wish I had started this earlier. Um, I cannot even begin to share the breadth of the different kinds of support I have seen. I see Zaradia nodding her head. The different kinds of breadth of support I have seen occur. And we laugh, we cry, we virtually hug, we get people through some really, really dark times. We share news of recurrence together. We share news of clear scans together. And we enjoy each other's company to no end. And it becomes an incredible relationship. It really does. And it's like no other relationship you can have. But it's an easy one because these people have this shared experience. Um, Take good care of yourself, get good sleep, eat well, eat right, get exercise, whether it's Tai Chi, yoga, walking, hiking. Walking and hiking outside also brings mindfulness into play, and that's a really important piece of this. Engage in life every day. Don't let life pass you by because life goes on. No matter what you have happening, life does go on. You don't want to miss really important events because of what you, or even the little moments that help you enjoy life because of what you have happening. So be aware that life does go on and grasp those moments because the gratitude that that's going to help keep within you and the enjoyment of life that that's going to help keep within you is going to help keep propelling you forward and help you maintain your sense of what's important to you. The other piece of keeping your head wrapped around things is to stop and think about what's important to you at any given moment. And if your treatment or the symptoms that you're experiencing in your survivorship, let's say it's chronic diarrhea that you can't get rid of, are interfering with that, which I imagine it would, you need to have a conversation with either your PCP if it's in survivorship or your oncologist, or if it's in your treatment with your oncologist and say, this is really interfering with what I want to do, with what I need to do to feel fulfilled, to feel like I'm having a quality of life. Um, and we need to talk. We need to figure this out together. And there's all kinds of resources that you can pull in for that. You can pull in palliative care. Palliative care are the experts of symptom management. The other experts are that are becoming more and more experts are integrative oncology, and complementary medicine as well. But they all can work together to help manage these and help you have a higher quality of life. The important thing is that you understand what is important to you. You understand what is happening. You document it so that you can articulate it, and don't be afraid to articulate it. This is your life. This is your day-to-day living. This is you grasping each moment. This is you having control of your life and having conversations about it and saying, this isn't working for me and we need to figure something out. Um, so don't be shy in doing that. Be polite, be collaborative. You're on the same team, right? You're all on the same team. Um, don't be afraid to pull in resources. Don't be afraid to think outside the box in terms of integrative medicine, in terms of complementary medicine. Make sure you're honest with your care team so that you're not doing something that can cause more harm than good, but just be honest. And there is so much to be said about mindset and about mind-body exercise. The National Cancer Institute really goes deeply into that and is doing more and more studies about how much good is coming of that in terms of decreased ER visits, terms of decreased readmissions to hospitals, increased health of people, increased satisfaction with their care when they're doing things like meditation, yoga, Tai Chi, um, walking, hiking, all things that are, and walking and hiking are things that you can do Tai Chi with your family. Think about doing Tai Chi on a YouTube video with your kids or your grandkids and how much fun they would have watching you make those movements and how much they would giggle at that and how much you can grasp enjoyment of life from that and getting exercise at the same time, or downward dog movements of yoga with your kids and grandkids. But you're getting exercise at the same time and enjoying life. I mean, what better gift than that? And and you are controlling something, you're grasping onto something, and you're taking care of yourself. And that's so important in all of this. So, so important. I can't even begin to tell you the difference that someone who does something like this, how their journey goes for them, as opposed to someone who just nods their head and says yes and goes along. There is great difference between those two journeys of someone who takes control of what they can and acts as a team member and collaborates across the board and thinks outside the box. So that's mindset. Mindset is taking control where you can and acting as a collaborator and thinking and understanding there's a mindset and grasping onto life and understanding that you don't want life to pass you by either and keeping track of the moving pieces. So I hope that's helpful. It's a lot, but keeping a journal, going back full circle, will really help you with all of that a great deal. So, Mark, I hope I kind of summed up a lot in a short amount of time.
Oh, we're gonna get more. We're gonna get more, believe me.
Is that helpful
W-
information to everyone? And does anybody have questions?
So
Would
first of
you,
all, wonderful. Mark, before you comment, let's use the hands if people want to raise their hand to whatever. But go ahead, Mark. What did you want to say?
Jill, would you mind talking about, because you already talked about it on our interview, about the experience you had this past weekend and how it relates to what you are trying to do?
Oh, sure. Um, so in October, I lost my 12-year-old grandson in a car accident. And which I mean, that was a very uh it's been a very rough year for our entire family, obviously. And on this past Wednesday evening, I was filling pendants for all of my family with his ashes for us all to each keep. And the thought that kept going through my head is a 12-year-old shouldn't be ashes. And that's really tough. You know, that's a really tough thought to be dealing with. Um, but we all had a wonderful time together celebrating his life. Um, and sometimes it's really hard to move beyond the anger of going through something like that. And then there are other times where I just think about his brilliance and his incredible sense of humor and I laugh. But all of us have continued to engage in life. Um, and none of us have stayed stuck. And I'm so thankful for that. I have nothing but admiration for my son and his husband in all of this. Um, because it is they are grieving, but they are also moving forward. What this event has done for me, one of the bright points of it is it has deepened my empathy greatly for working with people who, such as yourselves, who have that line of demarcation of before and after your diagnosis and going through a life-changing event. I mean, that's what happens when you're diagnosed with cancer. You are not the person you were before you were diagnosed. And thanks, Ed, buddy. I appreciate that. But you aren't. You are a changed person after your diagnosis. Um, and you become so much more aware of things around you that you weren't aware of prior to this. And so from tragedy, there are blessings in the awareness and in the empathy and in the understanding what other people are going through. And so I grasp onto that, and I am thankful for that. That has been a blessing out of this. Um, so it's, you know, it's a very fluid uh sense in terms of emotions, and I'm sure all of you can relate to that. So, thank you. Thank you. So, we had a wonderful time at the beach together, and he loved the beach, he loved the water, and it's what he would have wanted. So all of us walked away with that sense.
So what was his name?
His name was Zane, Zane. Thank you for asking.
I'm so sorry for your
It's
loss.
okay. It's life, you
Right.
know?
Yeah.
It's life.
Can I
So,
ask you a question?
sure.
What motivated you to get into this field as a professional and not a doctor, however many years ago that was, and when was that?
Nursing. So, nursing, I think, was always in my blood. And um, I have had a very mixed career. I went into oncology in my first year, and then from there I went into critical care and a lot of analytics. And then I went back into emergency room nursing, which I learned so much in. Oh my gosh. And then the emergency room I was in closed. So I went into bone marrow transplant on
Bone
the
marrow
inpatient
transplant.
side. Yep, bone marrow
Really?
transplant for 3 years. And I learned so much, but also I mostly worked night shift. And I had a
Oh,
lot of
so
really deep conversations with people in that environment, if you can imagine.
So I'm just going to jump in. I am 12 and a half years now, cancer-free from leukemia, and I had an unrelated stem cell transplant in 2012.
Wow.
um
And Amanda Ferrero, I think, wants to comment. She
Yes.
knows. Do you want to jump
Hi,
in, Amanda?
Amanda.
hi, I just was able to sign in. Yes, I had a stem cell transplant 5.5 years ago now.
Yeah, and post stem cell transplant is a journey of it in of itself, right? I mean,
Yeah.
that's
Yeah.
especially if it's an unrelated donor. It's insane. The whole process.
Oh
Whole
yeah,
thing.
I know, and
The
I'm
whole
still
thing.
dealing with it
Yeah.
now, actually, as you know. Yeah, having some issues, but yeah, it's quite crazy.
And then I managed a medical oncology clinic and infusion center for some time. And while I managed, I also was on the infusion side quite a bit and was ambulatory side for malignant hematology and cellular transplant. And I did navigation for several years, and I was also lead navigator. So very storied history with oncology nursing. I'm very passionate about it. I love it. I'm very much into evidence-based practice, but also really understanding the need for people to be effective self-advocates because so much can
Yes.
happen. There's
Yes.
so many gaps in care can be avoided if people feel comfortable in speaking up for themselves.
My
And I'm sure all of
cancer,
you get that.
my cancer relapsed in February of 2012 because of the incompetence of the Canadian healthcare system. So,
I'm so sorry.
well, where's Dawn? Dawn Helgeson was here. Anyways, I finally forgave that hospital last year. I'd like to say I'm fast at forgiving, but I realized I had held on to this for so long.
It's
But
hard not to.
it's
It's hard
it's
not
it's
to.
yeah, it's whatever.
So it really is. It's hard not to let go of something like that. I mean, there have been things I've hung on to as well.
Yeah.
But between navigation and the support group, and then complex case management for an insurance company where I did oncology and hemophilia, complex case management, it became so apparent to me that people really needed to be given tools to be able to advocate for themselves effectively.
I'm gonna call out John Brent right now. I don't know if he can turn on his camera. He's literally at the hospital, or was at the hospital with his friend Jessica, advocating for her right now. And while he was doing this afternoon, doing that, he was the one that was sending out all the emails. And there he is. Hey, John, do you want to talk about your stem cell transplant and that you're Canada's oldest living stem cell transplant recipient? Can you jump in?
Totally. So I'm just here with Jessica right now. Can you guys hear me?
Yeah.
Mhm.
Okay. Hey, Jess. Say hi.
Hi.
But yeah, we're in the ER because she's an active cancer patient going through her own self-advocacy journey, and we're both cancer survivors. Really quick, you have like an unbelievably storied history, and I think there's a few of us transplant survivors here. I got mine on my dad's birthday, November 13th, 1998.
98.
So I will be 26 years this November.
Unbelievable.
Post
Wow.
bone marrow transplant, and
Unbelievable.
30 years this December post diagnosis for acute lymphoblastic leukemia. Lots of long-term effects, you know, from all the
Mhm.
treatments and all the radiation and all that kind of stuff, brain tumors and lung collapses, and I'm losing my vision now. But self-advocacy is the way to go. I mean, we're
Yes.
literally in the hospital right now, and there are some people that are here for cholesterol or blood pressure or diet problems. So no system is perfect.
John has become one of my closest friends. He's amazing.
Love you, buddy.
Love you too, man. So how cool is that? I keep wanting to say, okay, Nurse Jill. Would anybody else like to unmute? We've got the thing going. So Mark, do you want to unmute for a sec? Like, should we pause it or should we keep it recording for a bit?
No, let's keep it recording. I think
All
this is all good stuff.
I want to call out
Uh,
Pam. Pam, do you want to unmute for a sec? Or Buddy, go ahead.
Yeah.
Buddy, go ahead,
Jill,
and then we'll invite Pam to share.
Jill, where are you located geographically?
I'm in Pittsburgh, Pennsylvania.
I had that feeling. I thought
Why? The way I talk?
yeah, I kind of got that Western Pennsylvania accent.
Oh, I stay away from saying downtown
I got
instead of
it.
downtown.
My
The nondescript accent.
My sister lives in Pittsburgh.
Okay, that's why you heard it. You got it.
Yeah, but I lived in Philadelphia I called
Mhm.
Philadelphia home for 8 years, but didn't really live there all those 8 years.
I'll forgive you.
It's okay. It's okay. It's a city of brotherly love.
Yes.
Whether they hate you or not.
Jessica, I hope you feel better soon.
We all do.
Yeah.
Rochelle, would you like to unmute? Would you like to turn your camera on if you can? And if you don't, that's okay too. Hey,
Hi,
welcome. Go ahead.
I'm having signal issues here, so I hope that I can keep my camera on. But Jill, thank you so much for coming and meeting with Mark. I actually met Jill separately. She is the real deal. I swear to God. She is just a joy to work with. And if you're a patient and need her services, I strongly advocate for her. She comes with topics that I don't even think I would do a little foray into, Mark. I think we started talking a little bit high level on it, but Jill will go all the way in. And so if you really want somebody to help move you along in your journey and just be there to support you, Jill is that person. And her book is amazing. Her podcasts are impressive. And I'm just preaching about you, Jill. That's it. That's all I wanted to do is come
Thanks,
on and say.
Rochelle. I don't offer individual patient services.
I know
There's
that you're
right. There's a lot of reasons why. But what I do is as Rochelle says, I advocate, I teach advocacy. I speak publicly. I have a podcast out there. I write on the topic. If anyone wants to understand, I'd be happy to talk with someone to help them understand how to advocate for themselves. But I don't offer individual patient services. I was a navigator for a long time, and I kind of have like, I want someone to be able to walk into an office and feel comfortable, or have someone with them and feel comfortable in understanding what information to look up, and getting a second opinion and having a conversation, because this is for the rest of your life. You need to be able to do that. You need to be able to move forward. And also, if you're in a group like this, you're going to be able, you can then, if you become an effective self-advocate, help other people on that journey as well. And it's, to me, that's just so important. Now, Rochelle's a navigator. She's excellent. There are navigators in your cancer centers that are very helpful. The financial navigators, thankfully, they're there. But there's so many moving pieces that even with those people, the small things can fall through the cracks. So you, as your individual person, you need to be able to catch them. You need to be able to write down your next steps. You need to understand, I should feel good. I should feel as good as I can. I should be able to speak up. I need to write things down. And so when you become an effective self-advocate, you can do that and you can communicate for yourself. And Rochelle, thank you for the praise. I really appreciate it. And Rochelle knows what she's talking about as well. She's excellent at what she does. But I've seen so many things fall through the cracks in my years as an oncology nurse that didn't need to. If someone felt comfortable, and I'm not laying any responsibility at their feet at all, but if someone had felt comfortable in speaking up for themselves, maybe that wouldn't have happened. And I think the watershed moment for me was in my support group where there is a physician and a PhD in public health. Both said they were terrified to ask their oncologist questions. I thought to myself, if they are, everyone is,
Mm-hmm.
you know?
Mm-hmm.
So the goal is to get people to feel comfortable with asking questions. And Amanda has my book, and Amanda, I love you. Amanda has her hand up. She has
I
her
know.
hand
We'll
up.
go to Zaridia first.
So go ahead, Zaridia.
Zaridia, right? Am I saying it right? Did I get it?
Narada.
Zareda. Oh my gosh. I'm gonna
Zareda. I'll remember that too.
FaceTime me and just say Zareda 10 times in a row. I'll shut
That's
up. Go
okay.
ahead. Go ahead.
That's okay. I just want to say thank you for this timely conversation, Jill. I've never heard someone in the medical community speak in the holistic way that you are.
Thank you.
And I had to learn everything myself
Yeah,
while
it's
going
tough.
through chemo. So for me, the 3 pillars of nutrition are the mental, physical, and spiritual. So you and I are very much aligned. And when I work with others, I have 7 things that I encourage people to do after a cancer diagnosis. After the number 1, which is take a deep breath. Number 2 is get a second or third opinion.
Yes.
Right?
Yes.
One of the things that I find that I teach my clients is advocacy for themselves, right? Which also comes with asking for help. But I have found, and it happened to me too, that my limiting beliefs and my traumas were actually getting in my way. And until I worked through those, identify them, investigated them, processed them, worked through them, I couldn't have gotten to where I am now. And so I want to say that advocacy, most people don't know how to advocate for themselves.
Right.
We
They
have
don't.
that, we have that fear, either the way we're brought up, the family culture, or we defer to people who have titles higher than ourselves. But like you, my motto is you don't know what you don't know. So you need to ask. You need to ask questions, and you need to advocate for yourself, because like you say, things do fall through the cracks, and we're all human. And so I love that you are talking a lot about advocacy, because I talk about it a lot. And I go deeper than that. I go to, when I speak on podcasts, I speak on devotion to self, because I find that people have to break through barriers in order to get to a point where they're feeling like, I deserve this moment to ask for
absolutely.
clarification. I deserve this moment to ask for more information, not just repeat it, but having the communicator say it in a way that the receiver can understand it. And if it takes
Yes.
more than one time, then that's okay as well.
It is okay.
So thank
It's
you.
excellent.
Thank you for that. As a cancer survivor and as a cancer coach, I advocate for those things so greatly. So I love that we're on the same page, because I don't hear that from the medical community that much. And that's one of the things I really like to change. So thank you.
I have a book out there, Zoraida, Cancer Journey Guide and Journals, Empowerment in Diagnosis, Treatment, and Beyond. And it has 25 steps to advocate for oneself. I'm going to be adding integrative oncology to that. And then it has guided journals to help keep track of everything. You don't need.
Is there a link maybe to Amazon that you could share in the comments? People are
Yes,
asking.
I can do that. You don't need it to advocate for yourself. It just helps keep things organized. That's all it does. And thank you, Rochelle. And actually, at the suggestion of Mark, I'm going to be publishing it in a different format to make it more digestible for other people who think about things in a different way, which I think is an excellent suggestion. So let's see if I can go ahead.
All
I
right,
like that
so,
idea, and
well,
I would love to share it with people who need
Yes.
more of that incentive of here's what it can do for you.
Yeah.
And
not everybody's as the more I hear this, the more I realize I'm an outlier. I was just obnoxious when they said I wasn't going to live. I just got obnoxious. I scrapped with the doctors. I mean, I just would get mad at them and be like, your services and competence, this is horrible. And so I'm saying this, that I'm so thankful for people, and I mean this sincerely, like you, that advocate on behalf of others, because
Yeah,
I've lost so many friends to just, some of them are absolutely unnecessary. So anyways, Amanda, can you is your camera working? There she is. My friend, my hero, go ahead.
I had to run to the store, so I don't have the in my hand. But as soon as I get home, I'll pop on live to show everybody. So Jill's book is absolutely amazing. It has truly everything you need in it to not only keep track of your health, but to make you feel like you can advocate for yourself. If the doctor says, oh, I don't have those results right now, you wrote it down, or asking you when your symptoms started, you can have it by writing it in this book. It truly is so amazing. I'm using it now just because I've had a little bit of the graft versus host disease issue, or dealing with it now, blood work, the whole 9 yards. So personally, I'm using it. I went to the National Coalition for Cancer Survivorship in Washington, D.C. Last week, the 26th to the 28th of June. And I brought the book with me. I actually had a few copies that I brought with me. And in that symposium or that conference, we have oncologists, we have, physical therapy doctors, we have nurses, we have things of all different natures, religions, creeds, whatever, everything. Every single person that I showed the book to, and medical students as well, every single person that I ended up showing that book to was so impressed and just felt like it was such an important empowerment tool for the patient. But not only that, but it would help the provider as well, because you have a patient who can give you the information that you're looking for, whether that's symptoms, test results, medication that they've taken, something that they may have had a reaction to that you might not have think to ask them. It's such an amazing book. I hope all of you can purchase it so that you can take a look at it for yourself. And there's also a few little funny jokes in the back that are quite funny, and I absolutely love that. But also, Jill is such an amazing person, and I don't know why everyone doesn't know her name. I met her when I did her podcast, which I'm so thankful to be on. But she's so nice and lovely and willing to help with any questions or concerns that you have. And I guess like other podcasts, it's more than like asking questions or like more of an interview. With Jill, it's more like a friendship, and you're just like having a conversation. She's an amazing person, very lovely. She makes you feel so warm and welcome, and it's definitely a fresh air when you are able to speak to someone about that, because sometimes it's hard talking about your cancer journey or what you're going through and what that's like for you. And she's able to kind of make you realize that you can. What you have to do, she guides you more. And I just got home, so let me show you the book. I'm so excited. I had to go get some ice because our ice thing broke. Goodness. Okay. So it's right here on my desk. Let's see if I can't. Oh, don't mind my laundry room, guys. I'm so sorry.
You should see mine. It's
You've got a
okay.
background on. We can't see anything.
Oh,
Looks like you're in the forest.
oh no. Did I take the background off? I don't know if I can. Oh, I don't know if I can take the background off. Here's the book. I have it. Oh man.
That's
Right
okay.
here.
We'll find it. We'll find
Here's
it.
You have to hold it by your face and it
Hold
might
it. Hold it
show.
in front of your face like this. Go like that.
Yeah.
Go like
Put
that.
your
Hold it.
face in there too and hold it by your ear. Kind of. There you go.
There you go.
There you go.
There it is. Mm-hmm. Okay.
So it's thick because it's mostly journals.
yeah,
There you go.
but you guys, see, I'll just read a little bit for you, like little sections. There really is. I mean, how to use the guide and journals. It's literally a how-to. She shows you everything's broken down. There is live your best life, take care of yourself, and empower yourself through the journey, the basics of effective self-advocacy on the cancer journey. So there's 25 steps in here. Keeping journals, the power of being respectful, direct, and polite, which is huge for me because I'm very loud, which a lot of you know, and outspoken a lot of the times, but sometimes it can come up as being like aggressive. So that was really nice for me to kind of read, like, you can be polite but very direct in the same way. I know, Boyd, you're laughing because you know me all too well. A second set of ears is
So
invaluable.
it took a book. It took a book,
Yeah.
Jill, to
I
get that
mean,
through.
yeah, you know,
You
I'm not
can
very-
now go. You can now tell your mom all her parenting meant nothing.
yeah.
You needed
Oh,
your
well.
reading a book to learn.
Well, because I'm always like, you know, you could be direct and you can say what you want to say and like be outspoken and everything. But with the book, it kind of like put it into perspective for me. Like, you can be polite and get your message across without being like, do this, I want that, you know, like there's a way to go about it, which helped. And then, oh, I really wish I could show you this. I wrote in it. Oh, here it is. Oh, right there. So there's different things of what to do. You could put the date, you could put your doctor's information down, you could put questions that you have, you could write answers to what the questions are. A lot of the times, like in my personal journal, I'll write the questions that I want to ask the doctor, but I never put the answer in so that when I come home from the doctor's visit, I forget what he said and I forget what the answer to my question was because I didn't write it down. I just wrote the question down. But in here, she has like a space for you to write what the answer was so that when you remember it, like you have it. If you can't remember, you have it. And then medications, vaccinations, supplements you're taking, the date, the dosage. There's information for insurance purposes, what your health insurance is, all of that. But this is really good for caregivers as well, because as a caregiver, you know, you have to keep track of everything that is going on with the patient. So you're keeping track of medications and doctor's appointments and the answers to what the doctor's saying. and there's a place for it. So imagine being a caregiver to a patient, whether they're old or young. This can help you so much because you could just take this with you to the doctor's office. The insurance is everything is in here. I mean, you could even photocopy it and like put it in the book with like a paper clip, so you have it. Questions you want to ask, who's your next of kin, you could put in here. Things that happen. It's just such an amazing book, and I think this should be in bookstores on shelves. But imagine getting this when you're first diagnosed with cancer. Going to the doctor, you're getting your test results, you're sitting there, and they say you have cancer. And then a patient advocate walks in with this book, and it says, this is for you to go home. We're going to start with page 1. This is how you're going to advocate for yourself. And there's guides to teach you how you can advocate for yourself. And on top of that, we're going to, any questions you have, you can write it in here. And when you come back for your visit, we'll talk about those and we'll have an answer for you. Here's the medications that you're going to start. Everything is in here. Everything is in here. It's
all right. All right. So I talked to her a couple hours ago, and I knew she was going to go fangirl, but this is like next level fangirl.
Amanda, thank you. Thank you.
I just want to be respectful of the time.
Sorry.
No, you're all good. Mark, should we stop the recording now?
Yeah, let me say a couple final things.
And the meeting's not ending. We're just going to wrap up this part. So.
Right. Rochelle Prosser, who came on earlier, is going to be actually speaking to the group September 30th. And she is also a nurse as well. And then on July the 22nd, we will have Michelle Sherhart. And she's going to be great. She's a survivor and has been through a lot. So we're excited about that. I want to throw out one thing that, and Jill's going to probably slap me over the head for saying this, but I'm going to say it anyway. I really feel, and this is my honest opinion, I really feel that Jill is going to be a major person in closing the gap between patients and the medical system, because she gets it. And I think she is going to play a very important role in doing so. And so I want to go back to Jill for one final thought, and then we're going to turn off the recording. We're going to still keep the meeting going. Jill, do you have a final thought before we shut off the recording?
Self-advocacy is a game changer. Effective self-advocacy is a game changer. And with that, I'm going to go so you can continue on your support group. I'm so honored to meet all of you.
Oh,
Mark,
last question before you do go.
Okay.
How do people get a hold of you?
Oh, so
because that's kind of important for those of us that aren't fangirls that didn't know about you.
There's a couple different ways. I will put it in the chat right now.
Yeah.
You can email me. This is probably the easiest way, at everythingcancerpodcast@gmail.com, and I'll put that in the chat right now for you.
Wonderful.
And everythingcancerpodcast@gmail.com. And that is probably what makes the most sense. You're welcome to reach out to me. And I'm so honored to be here. I'm so honored that Mark invited me. Thank you, Mark. We've
Can
had
you
a
stick
lot of
around
really
for one moment after we turn the microphone off or the camera because somebody wants to say something.
Sure.
Okay, so I'm going to end the recording right now. Hold on.